be my almost 6-month update since I've had my breast explant surgery, which was on June 27th, 2018. I had removed, for those of you who haven't seen my other video, I have removed 375 cc silicone breast implants that were placed underneath the muscle. These were removed, and they were removed with the entire capsule that usually surrounds the implant after you've had it in for some time, which is your immune response essentially kind of attacking the implants, and you want to make sure you remove that entire implant and the capsule that surrounds it. All right, so since then, I have been focused on trying to improve my scars. My implants were removed from underneath, so I have a 10 centimeter scar underneath each breast. And I also have been trying to improve skin adhesions. So skin adhesions are essentially when some of your skin tissue is somewhat attached. You have the fascia in there that it's really, really tight, and it creates a little bit of indentation, especially if you didn't have a lot of breast tissue to begin with. So once you don't have that support of the implant that you used to have and it's removed, your skin, if there's not a lot of breast tissue, essentially can get stuck, and a lot of scar tissue can be creating that is pulling some of that skin in and attaching it to your muscle fibers. So it's very important after your surgery that you start focusing on how to break up that scar tissue. I personally read a lot about cupping. For those of you that don't know what cupping is, or perhaps you've seen a lot of athletes use cupping as a way to release toxins. But cupping there's different types. There is some that come with glass, and there's others that come with silicone. And this one's a glass cupping set that I purchased. And what you want to do is you essentially, in the area that you have that is causing you a lot of stress, or that there's indentations in your tissue, you want to use this as a form of massage and suck out, allow it to kind of suck out those problem areas. I would suggest using some oil. This is the fractionated coconut oil, which is what I recommend and what I've been using. And you want to go ahead and place some oil in those areas and kind of do a little bit of suctioning and allow the suctioning. You'll see that when you do suctioning, it gets red like a huge hickey. So it starts getting really red, and you want to leave it there. After it starts getting red, I would say leave it on for, I don't know, like 20 seconds, 20 to 30 seconds. And move it around and leave it there for 20 to 30 seconds. You want to go up to maybe like a minute, no more than 2 minutes is what I would say. And leave it for 2 minutes, move it around, and you want to do this for 10 to 15 minutes a day. Definitely don't start off going 30 minutes of cupping in those areas, in those small areas. So again, I would heavily recommend that you guys buy your own cupping set. And there are some that allow you to have more suctioning power. It's either connected to some sort of a system that can allow for more suctioning power. Mine is limited suctioning power because it only has as much suctioning as it has air in here. But it has worked fine with me. I think next time I would have gotten, there won't be a next time for me, but had I known more about it, I would have gotten one where I can control the suctioning, because sometimes I didn't feel like it was enough over time. So you guys can get the cupping set, use some fractionated coconut oil in those areas that have indentations and where you feel like your skin is somewhat getting attached to your muscle fibers. You want to go ahead and break that up with cupping. One more recommendation I have regarding adhesions is some sort of a supplement that can help with that I've personally started using is Serrapeptase, technically known as Serrapeptase, and it is found in the digestive tract of the silkworms, and it helps break down and digest protein. Specifically in silkworms, it helps them break out of the tattoo and break down that, it helps them break down the cocoon, and the cocoon is made up of fibrin, and our scar tissue, which is really hard, is also made up of fibrin. So the idea is that by taking that supplement, we also, by taking a high dosage of Serrapeptase, we would be able to also break down that scar tissue, and that's something that I've only been taking this for a week, so I can't attest to it at this time, but I will make sure to provide that review. And you don't want to take more than 30 milligrams per day. You want to start off at a low dosage between 10 milligrams to 20 milligrams, which is 40,000 units. I have the Doctor's Best brand, 40,000 units, and then I can work my way up to a high potency. They also carry a high potency one, and hopefully I can also break down the scar tissue from the inside. As far as the scars, I've used the new gel strips. They're silicone gel strips you can place directly on your scars, which kind of helps provide some collagen and some vitamin E, and helps your scars fade. I've not been very good at using new gel or any type of silicone gel strips as I should have, and my scars are still a little bit red. I'm not sure if you can see them here, but that's my scar. It's a 10 centimeter scar. It's on each side, and that's kind of like where I am right now with my scar treatment. So hopefully as some time goes by, those scars will continue to fade. And I just want to continue to encourage women to, do what's best for their bodies. If you're at a point where you have decided to remove your breast implants and no longer replace them, I want you to know that everything at first seems horrible and it's very stressful, and you think you're going to be very deformed. And when you get out of the surgery, you'll look at your breasts within the first week, and you will see a lot of swelling and you will see scars, and you're going to feel like Frankenstein. But to be honest with you, as time goes on and you do your best to put in your effort and your part to improving your recovery, it's really not that bad. The scars will fade. So when you first look at yourself and you think you have scars that are going to be there forever, it's not going to be like that. They will fade over time. I just think you have to have a lot of patience, and you really want to allow yourself to heal in those months after surgery, and hopefully follow some of my advice on how to remove your scars or your adhesions, and hopefully get back to some sort of a workout routine, because you will not be working out immediately after your surgery for up to 2 months. So that can take a toll. It took a toll on me, and again, a lot of it is just patience and learning and gathering information so that you know what you need to do and how best to carry on with your healing journey. So again, I am grateful for all the women that have messaged me. I'm happy to hear about your stories, and I'm happy when my story has given you the courage to take that next step in removing your breast implants.